Providing patients with high-quality, efficient care across the maternal-infant care continuum is a challenge faced by many providers. GE Healthcare understands this and is helping to provide transformational digital health solutions and services to meet their needs.
And then little baby with tons of hair, and that's Jocelyn.
Vanessa Ortiz is the proud mother of 3 girls and is currently pregnant with her 4th child. A concern with an earlier pregnancy requires her upcoming delivery receive special attention and care.
I wanted to be a VBAC after the cesarean, so I felt a little more comfortable coming here knowing that the nurses were on top of things, and I knew they were going to be monitoring myself and the baby. For me, knowing that it's GE and I've done this already with them, it puts my mind at ease to deliver, which I'll be delivering again in October.
The monitoring system that brought Vanessa peace of mind is GE Healthcare's Centricity Perinatal.
Centricity Perinatal is a computer system that you use in the hospitals in the maternal infant care space. With all of the different equipment, Centricity Perinatal takes the data from those devices and pulls them into a system so that the clinicians can see all of that information together, not only from the different devices that they would use in labor and delivery, and as well as recovery, postpartum, and even with the baby in NICU. But it also takes different data that they're pulling in from the different systems that they may be using for documentation, documenting in Centricity Perinatal, aggregating it all together to give a complete picture of what's happening to mom and baby.
Centricity Perinatal came about as a partnership between GE and nurses. Would you say that nurses feel supported by this partnership?
Oh, yes. Just being a nurse and helping kind of get our hands in, develop the product, always having, our information to give them to better every product, every new release. The partnership is amazing.
As we know, nurses are on their feet almost their entire shift, and they're running around the unit, they're caring for patients, and anytime they have to take extra steps, extra movement, extra looking and assessing, that's waste. And so in terms of productivity, having a program such as this that's efficient, that helps them to do their jobs efficiently, again, being able to focus on the patient more and on technology less, that's interesting to me.
To me, that was peace of mind, knowing that it's been around for years and that it's progressing with how medicine progresses too. I'm very confident in coming to this facility and knowing that they have all of my records and they know how my previous pregnancies have been as well.
It's like having an extra set of eyes. So you see it there at the bedside. Centricity Perinatal has taken a focus of how can we complement the enterprise systems that hospitals have. And so we've created a module called Connect, which allows the clinicians to always view that fetal tracing, to be able to aggregate data from that enterprise system onto the strip, to really correlate what's going on with the documentation and the strip itself. We also have tools for the clinician to actually look at the fetal strip itself and analyze it. Really important to be able to see what's going on and properly understand what that fetal monitor is telling you about the health of the baby.
I love the interoperability between the two EMR and Connect. I can be in Connect looking at my strip, charting my strip, and I can be in our EMR and definitely be doing things in both places and seeing the fetal strip.
Through AWHONN recently, we released the Maternal Fetal Triage Index, which will help people actually look and see when a patient comes in and care for that patient in the immediacy as their condition requires.
We are very supported by GE. GE has definitely listened to everything a nurse has said to try to get every upgrade into more of a friendly workflow for us nurses. Very compatible with other EMRs that work great with our workflow of taking care of patients.
GE has been a wonderful product for us, and they're very innovative. They're looking always for new ways to improve the product. So the sky's the limit. I can't even imagine it. Someone else will probably imagine it and then make it be.
Though the maternity needs may vary by hospital, GE Healthcare's Centricity Perinatal provides an adaptable solution for maternal infant care. Developed by nurses for nurses, Centricity Perinatal delivers reliable, continuous information to clinicians so they can provide the best possible care for moms and their babies. From Rockford, Illinois, I'm Lori Pinson.